Good afternoon, everyone, and welcome to today's edition of our WHAM Spotlight series, where we talk with different people who have worked or experienced HIV in different ways over the years. And today we're really thrilled to be able to be with Vaughn Biggs, who is with the Broward Regional Health Planning Council, working for them professionally, as well as working with us on our Ryan White Part A Planning Council as well. So welcome, Vaughn.
Well, thank you very much. Thanks, Andy. I really appreciate the opportunity to talk to you and to everyone out there.
Yeah, so full disclosure, I've been working with Vaughn for, gosh, it's almost 2 years now, isn't it?
Has it been that long now? Yes.
Yeah, it's a weird COVID relationship. I don't think I met Vaughn in person until many months after initially meeting virtually. So we both serve on the planning council. So just getting things started here, the question that we always start out with is, what are your earliest memories of hearing about HIV or AIDS, and what things do you remember about that?
Right. I remember early on, I'm from Indiana, and I remember early on, we had this young gentleman by the name of Ryan White that moved into the town next to my town, basically. Actually moved into the same city or town that my mother grew up in. And remember hearing about this and about AIDS. And of course, in school, we didn't have a lot of knowledge yet about it. And then, of course, with his passing, we have, Michael Jackson and all these people coming to basically a very rural community in Indiana. And that was kind of my first thought of what this was. And then, then you hear things like, this is the gay disease. The gays are being punished according to, our philosophers of religion, things like that. But it was really a lack of education. And then it came down to almost feeling like if you were gay, you got AIDS. And I've often thought about, as a teenager or a young man, wondering, is this true? Just because you're gay, you get AIDS? And I think sometimes I wonder if that has made an impact of what we term coming out of the closet back in the early 80s, because of that fear. It's, oh, if I acknowledge I'm gay, maybe I'm going to get AIDS. And I think, in simplistic terms, especially young adults, and the fact that, we didn't have the internet back then. We didn't have Facebook. We didn't have media per se. So our information came from news channels and newspapers. There wasn't a Google to search. So I think there's a lot of, a lot of that misnomer is gone now, obviously, because we do have the ability to get that research.
So as a young man, were you thinking that you had a connection to this at this point, or in Indiana and during the Ryan White story? Because it was so in the news, it was all over People magazine, it was all these celebrities kind of descending upon Kokomo, or Greater Kokomo, as it were. Did you feel like, oh, they're talking about me at all, or where were you with all that?
No, because which is, I know I have an interesting story, but being in my 50s now, I actually was married for 32 years. I have 2 children, and I was not gay or had any inclinations that I was gay until my early 50s. So, I did the responsible thing. I grew up raising family, taking care of family. I lived in a very rural area within Indiana that had, I would say, I look at simple things like, I didn't grow up with any Black people in my community. Didn't grow up around a lot of things because we were a farming community. There was not a lot of that information. there were the jokes, there were of everybody were, they were called, I hate to say the word, the faggot, the gay, you're queer, all that growing up, from so many people, mostly the mean kids, that's common in every culture we have. Um, and and I still talk to a lot of my high school friends,
Mm,
and even when we look back, they're like, oh yeah, we knew you were gay. And I'm like, I had no clue. But at the same time, there's no, they're like, okay, great, keep it moving, keep your life moving. But as far as an impact that he had or a connection, no, it was just in the media and oh my gosh, this is surrounding an area that we're close to.
mhm,
So it's that's really the only impact it really had on our lives that I feel. So
mhm, mhm. Well, I think that's one of the things we've really been working on at the museum is trying to reflect the incredible diversity of what people's experience of this
mhm.
was
Right,
across the timeline. So it's we focus so much on New York and San Francisco,
right,
and um, and I personally think that that's really important to reflect these other parts of the country because you start to really understand how slow things moved. They moved
right,
fast on the one hand, but they also moved really slowly, and people didn't make these connections. And I think it echoes all the way into what we're dealing with today. Is that
right,
in a lot of circles, people aren't aware
right,
of the point. They're just not thinking about it.
right, right.
Um,
I
so
completely agree because, and you think about it as, 16, 17, 18-year-old person with no really information exchange highway other than the newspaper or the news media. We're not tied to our phones like we are today.
mhm,
So it become that was not part of our life because it wasn't in our face 24/7.
right,
Now if something happens, like let's say, for instance, COVID, everybody knows everything as soon as it's published. It doesn't matter whether it's right or wrong, they know
right,
about it.
right.
So that's where I see the times have changed so dramatically.
Mhm. Absolutely,
Yeah.
absolutely. So you sort of fast forwarded in your life and got involved in things. So
Right.
tell me about finding your way into doing community planning because for those of you who don't know, Vaughn has pretty much immediately took on a leadership role within our planning council through our community empowerment committee. He ended up chairing that, and then just recently, are the chair of the entire planning council. Uh, we have a new chair and a new vice chair.
Yes. Yes.
That Vaughn, you took on that role. So you've gotten into this sort of leadership role of talking about things. How did all that play out?
You know, when when I thought about this question, I
Hmm.
think back, before I moved here when I was in Indiana. I didn't grow up as a religious child or as a PK kid or anything like that, but religion in some way was part of my life. And so is the elderly. I've always had a strong connection with an elderly population. And then you start hearing things as I was growing up and being a young adult about patient advocacy, about people who can't speak for themselves. Now, that doesn't have anything to do with HIV. I mean, it does, but it doesn't have anything to do specifically to HIV. We're just talking ageism in general in some cases. People who don't have support to come in with them to their doctor's offices. So as I was going through things and was still involved in churches and doing things, I actually started working with a couple of organizations just out of happenstance. And one was, um, oh gosh, now you're going to make me forget what the word was. No One Dies Alone is what the acronym is for. And it's basically you would go into a hospital and you were trained to go in and you were the only connection to that person because they had absolutely no family. And basically the doctor had signed that they were going to die probably within the next 72 hours. So being downtown Indianapolis, we were in a community with a lot of people from different countries because we have a very strong medical organization, and you'd get people from other countries. They would get deathly sick and almost die, but their family couldn't get here to see them. So I started volunteering. I get calls all hours of the night for different reasons to come in, and you would sit at a 3-hour shift. So that kind of started my process. Then when I did come out was in the gay community. I heard so much about, HIV, and I'd already done a lot of research just on general in regards to HIV, and got in contact with an organization called Team Friendly. And it's all about the stigma against HIV and how to fight the stigma, and really how to, not let stigma get to you as an individual as well. It's, to me, the stigma comes from within. And so I got involved in those organizations, and it just kept adding and kept adding. And then fast forward to relocating to Fort Lauderdale. My job changed. I was in sales and marketing for 25 years with the same organization, and but decided I wanted to do something to give back to the community. I'd had a great job, a great career, but now there was time for me to do something more. And so I actually attended kind of like a conference, not a conference, or a workshop through the Pride Center. And there was a gentleman there who happens to be our chair, Lorenzo, was teaching a class that I was taking, and he brought up it just in a conversation about the planning council. And I don't know what it was, but it just piqued my interest. And so I talked to him about it and contacted the planning council and joined and just hit the ground running. And I've just learned that within, and I'll say within the Ryan White community, because really that's the population we're serving. Obviously the HIV community is much larger. People don't realize how much our voice does matter. Mm-hmm. And I think for an individual as me, I've learned how much my voice has mattered. If I can empower someone to be okay with talking about their status without stigma, or even be able to just to speak in words what they're feeling, how they're dealing with issues, to give that empowerment, to me, I've done what I set out to do, and that makes me very happy as an individual. So it's constantly my goal to speak for the underdogs, and it just continues to drive me. The more I learn in this community, the more I may get a little frustrated, but it pushes me to keep going and keep asking more questions. I'm a very inquisitive mind, so I'm always asking questions, and sometimes they ruffle feathers. I don't mean to, but if I want to know an answer, I'm going to ask.
Mm-hmm.
So,
well, I think that's one of the really cool things about you and about your approach, is because I think that we really need that. There's some people who I have a lot of respect for, who have worked in HIV from the very beginning. Mm-hmm. And so they've got this, and they're really driven, they're really, they have a mission, right. And that's the thing, and that's wonderful to have them, and it's wonderful to have that continuity. And it's really important to get new perspectives, because right. It's very different now in 2022 than it looked in 1992 or even in right. 2012. Right. So much has changed just in these past 10 years, mm-hmm. that we need to have a variety of perspectives coming through. Of course, we need the history, we need the continuity, but we also need right now, this is what it's like when you're relatively new to it and navigate.
Right.
So I think that's a really interesting thing, which kind of brings me to the next question we were going to talk about, which was about, you do go out now and speak publicly, and you're doing all these different things. We've got this community conversations program we're doing, right. The planning council. In general, what you encounter out in the world, what do you wish people understood more about what was happening with HIV/AIDS right now? I mean, like, what do you see, like, where do we need to really get people up to speed?
Right. Well, I see two sides, and that's the people who, you know, that really have HIV, and then the people who don't have HIV but don't know enough information. So it's two different, you got one set of people that really understand it, and then one set that don't. So I think the biggest message is always, it's not a death sentence. If you're taking care of your health, ultimately, as it was preached to me, and I still believe to this day, you are responsible for your own health care. Within our community of Ryan White community, there's so many programs to help you with that, but you need to step up to take advantage of those services, to be able to use those services. You've got to speak up, you've got to be heard. They're not, and some people don't want to use them because they feel like, oh, I don't want to use that service because I don't want to take it away from somebody else. And that's not true. That's not going to happen. They want to be able to provide services to people. There's a lot of strides that have been made, if you think about to the 80s. People taking 20 pills a day, of a cocktail, basically making them sick, and everything that they took gave them some type of other ailment, basically, to where now we're down to one pill once a day, or now they're working on injectables once every month or once every 2 months. So we've made great strides in that. And I really think the message of, I've always grasped the concept of undetectable equals intransmittable, only because it is so true. The studies have been made, the studies were all done at, 200 and below, you cannot transmit, and I just think that's a powerful message. And it's a powerful message to fight stigma, I feel, as well. And I just think that our medical knowledge has gotten better and better. And then I think within our own Ryan White community, what other community out there has the services and the where behind of it all? I mean, cancer doesn't have this type of program. People living with cancer, people who are living with all other diseases, diabetes, cholesterol issues, heart problems, they're not involved in a program that is allowing them to manage their health. And in some cases, we have seen people manage their health better by being involved in a program than not. I mean, you think about recently, what was it? Oh my goodness, the gentleman that said, is a Black man that came out and said, I've received better health care because I'm HIV positive than I would have received had I not been not that that's a reason to get HIV, mind you, but I think it goes to show the efforts that our medical industry wants to keep people in care, wants to keep their health care in check, which is what we want for everybody, not just people with HIV, but everybody in general should be seeing their doctor on a regular basis and getting their mental checkups, their health checkups, their dental, all that should be checked on. It should just be tossed as a wayside.
Right.
Yeah,
absolutely. I think two things I wanted to go back to and ask you about here, because I think a lot of people don't understand how comprehensive the Ryan White program is in terms of all of the things that are considered in that program, that even if they don't actually provide the service, they're thinking about housing, they're thinking about food, they're assessing these sort of from a total wellness kind of perspective. But the most basic thing, the very first thing that you said was, it's not a death sentence. And I think that's an interesting point that you bring up, and that we want to get the message out about. So you still encounter people who are living with HIV, or maybe have just found out that they're living with HIV, that are still thinking that, right? Tell us about that, because I think that
they're still thinking that, as well as when they hear someone's HIV positive, their response is, oh, they have AIDS.
Right.
And I think that understanding of what HIV positive versus AIDS is a total there's a wide span to get to that level of AIDS. That means you have not been taking care of your health, you're not taking your medicine, you're not taking care of yourself. You've gotten to a level that now you are actually in a condition of AIDS. And I think people, I would say like my parents' generation, growing up, all they heard was AIDS. That's all they heard. This was an epidemic. It was affecting gay men. All they heard was AIDS. It wasn't HIV. It was AIDS.
Right.
And I think so to this day, some of that still trickles down in their minds when they talk about it. When I talk to people who aren't familiar with the LGBTQ community, also they don't realize that it's not just the gay community. I mean, HIV knows no boundaries. There's no gender, there's no sexual orientation, there's no skin color, nothing that is going to that says, oh, I'm not touching them because of that. No, and we're in an age where people were born with HIV and have lived their entire lives with HIV. And, and we've had people that are still living today that had HIV and AIDS back in the 80s that are still living today. And some of those stories to me are amazing to hear, because the wealth of knowledge that, as I said earlier, our older generation that they can bring, you can't get some of that information just out of a textbook.
No, yeah. And again, you've said the word several times when we've been talking about empowerment. It's very empowering to hear those stories and how courageous those folks were,
right,
in advocating for themselves at a time when it was a really unknown, scary thing,
right,
to do that. So we just got a little bit of more time left, but one of the things I wanted to talk to you about, because it's what we're all struggling with, is what do you think about, like, what have you seen that seems to be really effective in working to battle this stigma? Because it really is, what I try to explain to people is, at this point, the only reason we're not able to make any more gains than we have isn't because of technology, really. It's really the stigma.
Right.
So like, what do you see out there that seems to work, or things that have happened that where you've seen like, oh, that got a little bit better because we did that?
Right. Stigma, to me, there's several ways to look at it. One, you have to look at yourself. If you're beating yourself, I have friends to this day, which, literally sit on the edge of their bed with a pill in their hand, crying when they have to take that pill because of the shame that they've allowed to control their life. And you have to be willing to learn. And what I would love to do, and I've said this in meetings, I know with you and other people, but I would love to change our narrative. I would hate, it almost turns my skin when people say, oh, they're living with HIV. And I like to say, I'm not living with HIV. HIV lives with me because it won't control my life.
Right.
If I stay in medical care, take my medication, I'm not going to pass it on to anyone. No one's going to get it from me. The only people that need to know about it are really the people who I'm sleeping with, a sexual partner. They're the ones that need to go. But when you look at the demographics of HIV and you see the percentage of growing in the heterosexual area, as well as women and other demographics are growing, it's not gay. It's growing everywhere. So I think some of that stigma comes from ourselves. We have to stop that. We have to stop that mindset, and we have to turn the power on that we have a voice. And what do I care if somebody I don't know has a comment on my status? One, they shouldn't. It's a medical condition. I came from a toxic community that I would sit at a bar and they would talk randomly about people who had HIV, like steak sauce for fries. I mean, it was like, I won't sleep with them because they have HIV. And I'm like going, but what if they're undetectable? It doesn't matter. And it's all education. And it's not educate. We're educated. The people who have HIV are pretty well educated. And as you see, the older they get, in their lifespan, the higher percentage of undetectable individuals there are, because they've had the information, they've had the knowledge, they've learned what it means. And I think when stigma comes in, it's easier for them to deal with because there is no shame in it. I mean, there are so many other reasons that HIV has happened, whether it was at birth or whatever. And so when people talk about stigma or blaming, I've had it. I've had it on applications where, people just say, "Why don't you go away and die of AIDS?" It happens. It happens today in this culture, and it's that mean girl philosophy, I like to call it. It's just like that energy doesn't bother me. I don't have time. I don't have time for that. I have greater and better things to do for myself and for my community to let any type of stigma bother me. And that stigma, not just with HIV, that's with anything for that matter. And I feel that you have to own that yourself, and you have to be able to, own up to that.
Yeah, well, I think was that?
I said, if that makes any sense.
And no, I think it makes a lot of sense. I think the only thing that I would want to add to what you said was that what you're doing right now, by doing this interview and talking openly about what your experiences have been and those kinds of things, I think that that's a big piece of this whole puzzle, is people being able to see other people who, have processed this. And so that whole process that you talk about, I'm not living with HIV, HIV is living with me. And, there's so much negativity right now about being politically correct, or about being sensitive to words, or, we're overly sensitive, but it really does indicate how you think about something.
Right.
And so it's important that we have these conversations, whether it's an individual spotlight interview, it's a community dialogue series program, the community conversations through the Planning Council, but being able to see somebody who's doing that, I think that that's just really, because you become a model, you become like kind of a role model for it. And I think that's sometimes people, like you didn't set out this morning to be a role model, but that's what you're doing by doing this. Is once we have things out in the open.
I think about back in the church. Yeah, I think back in the church days, you didn't want to be in leadership, and those are the people who need to be in leadership.
Right.
Same in our community. You don't set out to go, oh, I want to be this advocate. I want to, yes, I want to be involved, but I don't set out to say I want to be a leader. It's the ones that are screaming, I want to be a leader, that we need to be afraid of.
Indeed, Vaughn. Indeed. That's some community planning wisdom coming at you there.
Right.
We're really close to the end of our time, so we always try to end this with something unrelated to HIV in general, but because you do a lot of this, you work in it, you volunteer in it. So when you're not doing this good work, what are the things that you do to recharge? Like what are the things that give you joy outside of this work?
Oh, wow. There's a lot of things, actually. I'm an artist. So my background is artist. I love working with color and shape and line and design. So that's a passion of mine. Since I haven't done much art since I moved to Florida, but back in Indiana, I had a gallery, I had a studio. But rent down here for studio space is very, very high compared to Indiana. Right. So that's an outlet for me to do that. I did purchase, when I moved down here, in a 55 plus community, which I had just turned 55 when I moved here. So I love, as I said, I like being around the older generations, and I find so many of the people in my building that are in their 70s and 80s, and I fix food for them. It's like, to me, it's another way of giving back. socializing. I'm a big part of the LGBTQIA community. I do like to hang out in Wilton Manors. You'll see me out, say hi. I mean, absolutely. And I have some very great conversations in the community, and it doesn't bother me to still continue to talk about it even in my off time, because it's when it's from your heart, you just live it. So recharging for me is just hanging out with my friends, enjoying Florida because I love Florida. I'm so glad I'm away from winter, and and the weather over here is perfect. And so to me, there's a lot of just being able to do that in communities, and I don't care what the conversations are. I just enjoy being around people, and that's energy. That in itself gives you energy exchange. You get good energy from people. It helps build you up. So
Yeah, absolutely, absolutely. Well, I have enjoyed that in my relationship with you, and I think that we really benefit in the community from you being there and just
no,
giving
thank
so much
you.
of yourself that way. So I appreciate it. So thank you, Vaughn, for the time today. I
No
think this is
problem.
really helpful for people, and certainly shed some light on the whole idea of being involved in community planning. If people wanted to get involved here in Broward County, what would they need to do?
Well, they could either reach out to you or I to begin with, but they can certainly look up, the HIV Planning Council online through Broward County. There is an application process. Obviously they'll want to make sure what you want to do. It is a commitment, and it is a volunteer commitment. And if it's meetings are sometimes during the day, and you're talking. For one committee, you're talking an hour to 2 hours a month for that committee, possibly. So it is a time commitment. So be willing to understand that and participate in that. But we really, really, as a planning council and a planning body, I'll say this: we need to hear from people who are HIV positive. We need people on the planning council who are HIV positive, and really some that are not involved with our community partners that we have. So, someone who's not working for an agency like we do, but some, just an individual out there with HIV that would like to participate and learn, and so we can hear from them, because we'll make changes based on what we can gather from the community. And I have learned that over the last 3 years of when you bring the information together, changes do happen. So I think it's very important to acknowledge that they do listen, they want to listen. It's not just hearsay. They actually will make changes if it's needed.
Yeah, absolutely, absolutely. Well, that's a great way to end.
Yes.
So thank you again, Vaughn, for
Thank you.
this day. And we do this on the first and third Wednesdays of the month. So look for us again in a couple of weeks, and that'll take us out for today. Thank you all.
Thank you.